I am Dr. Rajib Kr Chatterjee, speaking on behalf of Modern Homeopathy Research Center, Dhakuria, Kolkata. I am giving an idea about the case-taking procedure and principle, which is very much essential and the backbone for the treatment in case of homeopathy. A homeopathy, like other pathies, had a pro forma of case record of the patient. That is, we say, number one, present complaint of the patient, that is the suffering, signs and symptoms of the patient is noted in a systematic manner. Here, the history of present complaint is essential. History of present complaint depends on the causative factor of the ailment. To treat the patient in homeopathy, the causative factor is the primary important on which the selection of remedy or the simillimum comes. Thereafter comes the patient itself. The patient itself includes the constitution and the diathesis. Suppose the patient is phlegmonous, stropulous, fatty or tubercular diathesis. And lastly, the effect, that is the final sufferings or the symptomatology which is emanated on the patient. Here, while doing a case taking, we should obey the dictum of our master Samuel Hahnemann that the physician must be an unprejudiced observer. To investigate the causative factors, it is again categorically classified as fundamental cause, maintaining cause, and the exciting cause. The fundamental cause is directed on the basis of the constitution, age and gender, occupation, moral and family relationship, and sexual behavior. Here, we say that most chronic diseases are caused by some list of risk factors, that is, smoking, poor nutrition, physical inactivity, excessive alcohol, etc. And also, fundamental causes depends on miasms, that is, acute miasms and chronic miasms. Acute miasms are again subdivided into recurrent, that is, for our lively example is COVID-19 epidemic. That is a recurrent acute miasm, and the non-recurrent miasms are the fixed miasm which occurs in the certain individuals, that is measles, chickenpox, etc. There are some exciting factors, that is, if a person has a tubercular focus and still continues smoking, then it is helping as the exciting factors to bring the disease to the peak, and acute miasm will react instinctively. Acute miasms will react instinctively and divided into soric, psychotic, and syphilitic. As for instance, soric patient will struggle much, psychotic patient will hide and conceal, and syphilitic patient will collapse or strike out. There are some maintaining factors also. For example, if a patient is suffering from chronic cough and tuberculosis and is at the same time living under asbestos or near any water body, that is the maintaining cause of the disease, that may be rectified as much as practicable. Here we say The past history of the diseases suffered by the individual are again to be noted systematically. For instance, malaria, typhoid, jaundice, chickenpox, measles, or any accidents or injuries, or any skin eruptions, or any bites of insects, animals, etc., suffered by the individual. Thereafter, the family history of the diseases in the family are to be noted systematically. For instance, cancer, asthma, TB, hemorrhoids, vitiligo, epilepsy, any mental diseases, hypertension, thyroid problem, diabetes, mental disease, suicidal tendency, or any addiction to alcohol are to be noted system-wise. Here also the physical generalities counts. The physical generalities includes the appetite, desire, aversions, thirst, urine, stool, sweat, sleep, dreams, and the mental symptoms are to be given the utmost importance. The mental symptoms counts of the grief and disappointment, worry, etc. that date back even to the remote past and even to the present physical diseases. Here also, to make the prescription more scientific and to tally with the modern medicine, the laboratory findings as done time to time should be noted on one side of the prescription, and at the top of the prescription the registration number of the physician, the qualification, along with the signature and date at the appropriate place should make an ideal prescription. So this is a brief and an extensive idea about the case history I try to put up in front of you. Ladies and gentlemen, some other lecturer may give this lecture in various other aspects. I have tried in my feeble means to put a short representation of the case history by homeopathy. Thank you.